Fetal circulation is different than adult circulation, primarily because the fetus is obtaining its oxygen and its nutrients from the placenta. So we do not want the blood to go out to the lungs in order to pick up oxygen, because the lungs are filled with fluid. So we have an interesting structure in the fetal heart, which is called the foramen ovale. So the foramen, that means a hole, and it's oval in shape. This actually shunts the blood from the right atrium to the left atrium, and it prevents it from going to the lungs. So this is a bypass. So it bypasses the lungs. Now, sometimes that flap, when we're born, needs to close, and sometimes it doesn't close properly. And then the doctor says, your baby has a hole in its heart. And what it means is that flap that is supposed to close over this hole so that blood will then go out to the lungs does not seal properly. And so in order for that baby to be able to get enough oxygenated blood, they might need to go in and do surgery to make sure that that hole gets sealed up. We talked about the difference between the umbilical artery and the umbilical vein. You'll remember that the artery is carrying blood away from the fetal heart. So this vessel right here, which is red, is actually your umbilical vein. So it is carrying blood back up to the body. It is going to transport it to the liver so that the baby's liver can help to detoxify the blood if there happens to be any toxins in it. And then it's also going to be put into the vena cava so that it's then going to go back out to, or back to the heart and then back out to the body. So we also have some other structures that help to shunt blood towards or away from the lungs. And these become actually, when the baby is born, these are actually going to become ligaments. And so this is a ligament that's going to close off, and it is going to close off that connection up here or down here by the liver. And then we have another one that shunts blood from the aorta right into the, from the aortic arch, from the pulmonary arch right into the aorta, and that is going to shut off as well. So that is the fetal circulation.